Can you tell us a little bit about the PATINA and what did it show?
Sure. So PATINA was a trial that looked at patients who had received 6 to 8 cycles of their induction chemotherapy with trastuzumab and or pertuzumab. And then at that point, they were randomized. So keep in mind, these were all patients who were ER positive and HER2 positive. So at that point, they were randomized to endocrine therapy alone, or endocrine therapy with palbociclib. So this was exciting for us because this is really the first time we had seen a trial showing the benefit of a CDK4/6 inhibitor now in ER positive, HER2 positive breast cancer. And just to summarize, the trial did show a median progression-free survival of 44 months for those patients who received palbo with endocrine therapy and continued their HP, compared to 29 months for the patients who had endocrine therapy plus HP.
Yeah. Dr. Pegram, there is something for me that a little bit bothers me about the patina, and I wanna get your opinion on that. So I always look at the control arm to tell me whether or not there was something bias happening. Like the control arm on the patina, which was basically the control arm of the Cleopatra, did amazingly well. Amazingly well. Like if you look at the Cleopatra, we saw a median PFS of 18 months. Here you're seeing 29 months on the Patina study. So there was patient selection. Like I cannot think of any other way to see so much better a patient doing on the control arm compared to the intervention arm. What do you think happened there?
Well, there's a couple of different forces at play here, actually more than a couple. Number one, these are all hormone receptor positive patients, which probably by and large have a more favorable outcome than hormone receptor negative HER2 positive patients in the first place. Number one. Number two, these are patients who had already finished their induction with no progression. If you look at the Cleopatra Kaplan-Meier plots in the experimental arm, there are some early progressors, even while they're still on the THP, and it's upwards of almost 10%. I've done the using a protractor. I've done the math on the graph in the paper, and it looks to be around 9% have progression while they're on THP. It's not common, but it happens. So all those patients are excluded from the patina population outright. The third factor is the times have changed. And in the DB09 trial, it has a higher fraction of de novo metastatic disease, which arguably has a better prognosis than relapsed metastatic disease as well. I think just over a third of patients in DB09 had a de novo metastatic disease, which is probably a more favorable patient population than people who have relapses after neo or adjuvant therapies.
I think to your point, I wanna just highlight it one more time, is that the induction portion was not part of the Patina study. The
Correct.
induction phase of THP was done off study, and then patients were able to randomize after based on basically the treating physician and the patient agreeing to go on that study. And whenever you don't do that, there are biases that can come into play over here because you're cherry picking the patient who had the best responses to that induction phase, whereas the other patient who have like maybe small progression or progression, you moved right away to something else. Whereas the DB09 casted a wider net. All patients from the beginning, there was no cherry picking over here, were allowed to enroll on that study. Dr. Rao, so now that we have the patina, 44 months. So some doctor will tell you, okay, here I see 44 months. The DB09 showed me 40 months. Am I triple positive? I'm still going to do THP and then give them the patina regimen. What do you tell this train of thought?
Yeah, I think, we're going to hear this a lot coming up because now we have options in the first line setting. But I really think what Dr. Pegram said was very important. It's important to remember that these were patients who did not have progression on their initial induction regimen, and then were randomized, and they were all hormone receptor positive. So I don't know that it's as widely applicable to all patients as we think it might be.